Hi, sorry I'm getting this to you so late, but this was basically impossible to film at Nationals, and we got back Monday. Just needed a couple days to gather my thoughts on this presentation. But my name is Megan Bowles, and my topic is mental health and recidivism in jails. And as kind of a background for this topic, it's definitely become an increasing problem. It's always been prevalent in jails. Most inmates have some kind of mental disorder, but now that mental health is becoming a bigger issue in our society today, this is very prevalent in the jails, and it links to a lot of recidivism, which, if you don't know, is basically going back to jail once you have already been there. There's lots of solutions for this, so I wanted to research what solutions would work the best to decrease recidivism ultimately. And last term, Grigsby said I should try to focus in Union County and maybe try to get some research on something more local and help out here. So that's what I've been kind of focusing on, how this can all be translated into our own local jail here. Some literature, I'm not going to go over all the direct sources of this specific topic, but a lot of literature talked about mental health courts, which is something inmates would get sent to instead of jail, and it's kind of a program they work through. They determine what program they need to go through in order to fix their mental health illness, and this is a way of keeping them out of the jails so they can actually get help for their illness instead of sitting in a cell and ultimately making it worse, because if they aren't getting any help, then sitting in a cell is just going to make it worse for them. Another article by Held talked about patient-centered medical homes when people are released from jail, and the findings did show that this decreased recidivism. Another one by Rotter and Amory talked about a diversion program, which is just something they would do through the jail. So basically, like CHD coming to the jail and having a specific program for these patients to go through, which is what the Union County Jail has right now. They have a kind of a diversion program. There's people that come into the jail, I believe it was like 3 times a week or something, but that's really not often enough, or enough one-on-one help to really fix this problem. And that's another issue I saw with Union County's policy, is they just aren't getting the resources for this, even though they do have a mental health policy. Their mental health policy usually just consists of that someone from CHD comes in a few times a week, I believe, for not very long, but other than that, it's just people that are in direct danger of hurting themselves or others, who obviously have a mental illness. If they're doing this, then that's more of an emergency situation where they have to act on the mental illness and get CHD involved, because that's who they call locally for that. So my ultimate question for this research is, how do mental health concerns affect jail policy, and what policies are most effective in reducing recidivism? And I guess I could kind of fix that up and say, specifically in the Union County Jail, my data and methods, I was doing secondary data analysis, I believe it's called, which is just finding other research and statistics on different mental health programs that other jails have tried. I've been looking up research on several other programs, as I talked about in the literature review. So that's definitely showed what can work and gotten a lot of information that way. And then another thing I wanted to do was interviews, and I was actually able to get a hold of, his name is Nick Hutler at the jail. He works specifically in the jail, he runs it, and so he gets first-hand contact with all of these people who have had these issues. He oversees all of that, and my conversation with him gave me a lot more inside information that I would have never found out about the jail. I guess a limitation to both of these would be the fact that there's no research specifically in Union County for this, and a lot of the research also is not necessarily in small areas or rural areas, so that's been hard to find more specific things that could be applied more directly here. And as for interviews, I would say it's always changing. Every year the people are different, different scenarios come up and stuff, so it would be good to maybe talk to him again later on when I continue this project. I'm going to talk a little bit about the interview now, because my literature review kind of involved a lot of my secondary data analysis. When I talked to him, I found it really interesting because I had a list of questions I wanted to ask, and I was definitely expecting different answers to a lot of them, because I knew that Union County had a mental health policy, so I kind of expected that it would reduce recidivism and help out a lot there. But after talking to Nick, it sounds like there's a lot of work to be done, and what they have going is more helpful than not having anything, but it is not doing nearly enough for these inmates who are mentally ill. He talked about, as I discussed before, how it's very limited when CHD comes in, so people really aren't getting that help they need. They're not getting enough time, maybe not enough one-on-one, just because so little time isn't going to do a whole lot for them. Another thing was the fact that there are just little resources in our area, just a rural area. So there's not a lot of resources, like there's not very many beds in mental places or at the hospital, and at the jail actually they can really only get like true one-on-one service if they are going to harm themselves or someone else, or like on the verge of dying, basically. He said a lot of these mentally ill people will refuse to drink water, for example, and in that case they can get CHD to come in, and because they are just trying to die, but it has to be in extreme situations. When I asked him what could be done, he thought that we just needed more beds here to put these mentally ill people in. And I actually asked him I told him that I knew there was a drug court here, which is similar to the mental health court, but more for drug addictions. And he actually told me that they are starting a mental health court, and then gave me the number to the lady who runs it, so I would like to talk to her about that and see if I could get more information. But he thinks it will be a net positive, but it will not completely fix the problem just because of so little space. I think he said only 10 people can get in there. And he said that in the jail there were a little over 1,000 inmates last year, and about 80% came back. So that is a lot for recidivism. And as for next steps in my project, actually I got an interview with the sheriff's office because I want to go into the field, and if I get that job, then I will be working in the jail, and I think for this project it will help me tremendously. I will get firsthand experience on that, so we'll stay tuned on that as I continue through the tests and interviews. And I would also like to call Taylor from CHG and get some more information on that, but have made some good progress so far. All right, thank you.